Before you start receiving ranibizumab, make sure to read the patient information leaflet given by your pharmacist. This medication is given by injection into the affected eyes by a healthcare professional. Your eye will be numbed before the injection and monitored before and after the procedure. The dosage will be determined by your doctor based on your medical condition and response to treatment. Typically, this medication is given once a month for most conditions. However, if you are unable to have monthly injections, getting injections once every 2 or 3 months may be an option, but it may not be as effective. It's important to use this medication regularly to get the most benefit from it. If your condition does not improve or worsens, make sure to inform your doctor. If you experience mild discomfort or increased tears in your affected eyes, be sure to let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor believes the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's important to be aware of potential risks. There is a rare possibility that this medication may increase your risk for a serious eye condition, especially during the first week after receiving a dose. If you notice symptoms such as pain, redness, sensitivity to light, or sudden changes in vision, contact your doctor immediately. It's also important to note that this medication may sometimes increase the risk of serious blood clots, which could lead to stroke, heart attack, and other blood vessel problems. If you develop symptoms such as weakness on one side of the body, trouble speaking, sudden vision changes, chest/jaw/left arm pain, seek medical help right away. While it is rare, a very serious allergic reaction to this drug is possible. If you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using ranibizumab solution, it's important to let your doctor or pharmacist know if you are allergic to it, other ranibizumab products, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have a current eye infection or have had a stroke. Before undergoing surgery, make sure to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that this medication may cause blurred vision. It's advised not to drive, use machinery, or do anything that requires clear vision until you can do so safely. If you are pregnant, this medication should only be used when clearly needed, and it's best to discuss the risks and benefits with your doctor. While it's unknown if this drug passes into breast milk, it's unlikely to do so. However, it's important to consult your doctor before breastfeeding. When taking ranibizumab solution, it's important to be aware of potential drug interactions. Certain medications may affect how ranibizumab works or increase the risk of side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This can help ensure the safe and effective use of ranibizumab solution. Always follow your doctor's instructions and recommendations for the best results. If someone has taken too much ranibizumab solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Make sure to schedule regular medical tests, such as eye exams, while you are using ranibizumab solution. It's important to keep all your medical appointments and consult your doctor for more details. Make sure to take each dose of ranibizumab solution as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor for a new dosing schedule. This medication is administered in a medical setting and should not be kept at home. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.